everything was full and there's no movements. We looked at beds that needed to have folks moved up into the hospital, but those folks can't move out of the hospital because the skilled nursing facilities don't have them. So we also came here with the plan to make sure that's being executed to work on that. We talked about 60 days ago with an anticipation this would come, to start to put things into place. And I first and foremost want to give a thank you to, I talked to Secretary Becerra when we were at the Mayo Clinic 2 weeks ago. I made the ask that these teams be provided. Senator Klobuchar followed up to help make sure that happened. And Lieutenant Colonel Shealy, who you'll hear from, and his team is here on the ground. You saw them upstairs training. I'm pleased of how quickly that was able to happen, about the interface that's happening between HCMC and that team, and the ability that will give to relieve some of the pressure that is on this facility. Next thing, I'm glad, and you'll hear from General Menke, we were over talking to our first group of troops who are on board, the 400 who will be receiving their training, CNA training, to be able to be placed and provide some of that relief in the skilled nursing facilities. That's all part of this chain of, once people move from down here in the trauma center, move to the hospital, and those folks move from the hospital to long-term care, and then hopefully home, is a part of that. And that is a major operation. It takes a lot of training. General Menke will talk about that in partnership with Minskew and some of the training. We need to make sure that everybody who is caring for those 22,000 people, our seniors, our folks who need the care in Minnesota, are as well trained as possible. We're giving them that high quality care, making sure they're ready to go. And he'll talk about that. They should be ready to go here in about a week to start giving that care. And then the alternative care sites that you see that are standing up across the state. We have those standing up in Brainerd. We have them in St. Paul, out in St. Cloud. You'll still continue to see, if the need is there, we will continue to move in that direction. And then making sure, I can't stress this enough, the biggest keys to stopping what you're seeing here is to stopping the spread of COVID through the most effective means is vaccines. I'm proud to say, as of today, Minnesota ranks second amongst the states in terms of adults that have booster shots. Fully 80% of our adults in Minnesota are vaccinated, and we are sixth in terms of the states of our 5 to 11-year-olds, continuing to climb on that. We have, and I would tell Minnesotans this, we have sites set up across the state. They are easy access, obviously no cost, for safe, highly effective vaccines. We also have testing sites, and I would encourage Minnesotans getting ready for the holiday here, getting ready for Thanksgiving. Jan will talk a little bit about this. It's critical that you take some common sense moves. Have the conversations with your families about who's vaccinated, who's not, how to make sure that's as safe as possible. And then after the holidays, Jan will talk about getting a few days time in there of getting tested and treating accordingly, and continuing to work on that. And I just can't, listening to the folks upstairs, I asked point blank, you've been at this for 20 months, how does it feel now? And without a doubt, every one of them said it's worse now than it's been. It's harder on us now than it's been. The people who are here are sicker than they've been, and the pressure and the wear and tear on the staff is as bad as it's been. So these moves that we're making now need to be done. We've talked about an additional $50 million being put into long-term care. You're going to hear from Jennifer D. Cabellas, the CEO here at HCMC. We understand very clearly this is a triage situation. We also are thinking long-term. We've got the Minskew system, Commissioner Olson. They're working on training up 1,000 CNAs in the next coming weeks to help backfill where the guard was. And then we have to think long-term of what is in our system is making that pressure. What can we do to ensure it doesn't happen in the future? And how do we train a workforce to be prepared post-COVID for the things that need to be done? But I'm just certainly grateful for the folks here. I'm grateful for this facility. I think it's one of those things that, and I hope Jennifer talks a little bit about this, about how important this facility is to the entire state. And she told me a very, very sobering statistic on the way up with her doctors. Folks from all over the state call for this major trauma center. And the normal thing is to say yes and transport people here by ambulance, by air, whatever it may be. Now we're having to say, no, we don't have the space. So I would remind Minnesotans, you may be in greater Minnesota, but to be very clear, the inequities of healthcare now are starting to fall heavily there, where the resources aren't there in many of those places. They're here. And that was a normal procedure where we shared that space. That is not possible now. So God forbid you're in an auto accident and you need to have this care. We can't do it because we're clogged up. And that is something that we saw and talked about months ago. and the need to be prepared and the need to do those things of vaccination, testing, and then protecting this hospital capacity. That is the mission here today. I'm grateful for the person who helps us coordinate all that. And I was very grateful to hear Ms. DeCabelis talk about how efficient this system was from the time that we requested these DOD troops, and how that process worked and how they ended up here. And the person who makes that happen, Jan Malcolm.
Thank you, Governor. Good afternoon, everybody. I'm primarily here just to answer questions that you might have on all these many moving parts. There's a lot going on to try to respond to the urgency of this situation. But I also want to say there's a lot to be thankful for and grateful for. There have been enormous progress made in the last year. A year ago now, we didn't have vaccines. We've got effective vaccines, we've got knowledge, we've got better treatments. So there's much, much to be thankful for about all the hard work that's gone on. But we are still in a critical moment. And as the governor said, these next weeks with the holidays coming up and all that means for travel and gathering are critical for Minnesotans to keep doing the right thing. We're grateful for the Minnesotans who've gotten vaccinated and who are doing what they need to do and can do, we all can do, to take better care of each other. It is a critical time for people to be mindful of the risk that's out there with this much virus circulating around our state. This is the time to be still doing those basic things that matter. Vaccination number one, getting tested so that you know your status and you can take the appropriate action, but also masking. When you see these workers, these healthcare workers who have been running flat out for 2 years now and what they go through every hour of every day, it's really not too much to ask of the rest of us to be mindful of the impact of our actions on this community. And as the governor said, it is so clear how interconnected all these pieces are. The health of the long-term care system directly affects the health of the hospital sector. And resources like Hennepin that serve the entire state. And we just come to just trust that it will always be there. And now we're seeing for the first time the heartbreaking situation of these people who live to say yes, having to say no. And with that, I just wish all Minnesotans a healthy and safe holiday. Let's be thankful for all that we've learned and all that we can do. And please be careful. Take good care of yourselves and each other. And with that, I'm delighted to introduce someone who's been a colleague of mine for a long time, the CEO of Hennepin Healthcare, Jennifer DeCabelis.
Thank you, Commissioner Malcolm. And thank you, everyone, for joining us today. Our commitment here at Hennepin Healthcare to Minnesotans and our commitment across all health systems. This is not a Hennepin Healthcare issue. This is a state of Minnesota issue. The healthcare systems across Minnesota work incredibly well together. And we hear that from other states. We hear that we have a phenomenon here that doesn't exist elsewhere, where we level load, we look out for each other, and we make sure at the end of the day, Minnesotans' health is at the forefront. Our mission here at Hennepin Healthcare is to be here for the health and wellness of our community and to be here when Minnesotans need us and where they need us. Hennepin Healthcare, as was mentioned, is Minnesota's largest Trauma One center for adults and pediatric care. And it has unique expertise for the level of acuity we treat here, for whether it's trauma, whether it's life-saving efforts. And we serve, as was mentioned by the governor, the entire state of Minnesota. So rural Minnesota, when they have a trauma that happens and they need a helicopter to fly, get them here. This is where individuals come. And we serve the entire urban and rural area. They rely on us for trauma and life-saving care. Providers across the state rely on our physician expertise to do consults, to call in, to take care. And right now, Minnesotans need to hear us say, demand for emergency and life-saving care has exceeded our capacity. Right now, our reality here at Hennepin Healthcare is we get more than 20 calls a day asking for transfers because of the acuity and the urgency of need to Hennepin Healthcare. 20 calls per day that we don't have the capacity to answer. We have 20 on any given shift waiting in our emergency department trying to get upstairs into inpatient care because they need ongoing medical care. And as was mentioned by the governor, we have 40 that are waiting to get out of our hospital walls to their next level of care, but they need ongoing supports in our community. And so we are grateful to the governor to Commissioner Malcolm and the MDH team, to our federal partners for making sure that we can still be here to respond to Minnesotans. And I want to just emphasize, when we exceed capacity, it doesn't mean people get turned away. It means we stretch our team members. It means we leverage other expertise. It means care access can take longer. It means rural Minnesota hospitals hold on to care that they don't have the expertise for a little bit longer until they can get somebody where they need to be. Transfers not happening is not ideal, and it can be life-threatening. And that's what we saw walking through the emergency department today, is every minute matters in some of these traumas. So we need all Minnesotans right now, all Minnesotans to stand up, to stand together, and to protect our limited and vital emergency resources the best we can, so that no one in Minnesota is faced with a life-threatening need without optimal care and recovery supports immediately available. We're grateful to the governor, to Commissioner Malcolm, to our federal delegation who advocated, to President Biden and the federal team who deployed. I can't say enough. We put a call for help on Friday. By Saturday morning, we had a phone call response that said, we're meeting with you first thing Monday morning. Monday morning, we debriefed and shared what the reality was here at the health system and the worries our providers have about care that they couldn't accommodate. By Tuesday, we got a phone call that said, federal team is coming, and can you be ready on Saturday? And we welcomed them within 7 days. That is an incredible government response that we are so grateful for. Our commitment as we care for Minnesotans is to be here when Minnesotans need us most, as we've done for over 130 years here at Hennepin Healthcare. We shared with the governor and Commissioner Malcolm earlier that we just saw a chart from our trauma team this morning that showed an alarming rate. This is an organization that is not used to ever saying no. And over the past couple months, we've had to do that over 400 times. We've had to go on a diversion for an organization that takes pride in always being here. So I want to emphasize that even though our federal supports are here and we are so grateful for them, it is a short-term solution. We need to play the longer game across Minnesota right now. Vaccinate, get your boosters, reduce high-risk behaviors, so that as a state, we can ensure each other that healthcare systems can respond when you or your loved one has a life-threatening emergency. And we can't emphasize that enough and say thank you for the teamwork. With that, I will pass on to Lieutenant Colonel Shealy.
Good afternoon. I'm Lieutenant Colonel Shealy, the officer in charge of the medical response team here today. We are here at the Hennepin County Medical Center in support of the Federal Emergency Management Agency at the request of the state of Minnesota to assist medical providers with the latest surge in COVID-19 cases throughout the local community. There are currently 23 active duty military medical personnel here from Langley Air Force Base, Virginia, and Offutt Air Force Base in Nebraska. Our team consists of military doctors, nurses, and respiratory therapists, bringing with them an abundance of medical experience and knowledge. Their expertise, coupled with that of the Hennepin staff here, will prove invaluable as we work together to tackle the rise of the coronavirus hospitalizations in the community. Since our recent arrival, the Hennepin staff have gone above and beyond to ensure the seamless transition and integration of our service members into the hospital team, to include credentialing, training, and orientation in just the few days that we've been here. And for that, we are extremely appreciative. We remain committed to supporting the Minneapolis and greater Minnesota community as we work to help relieve the pressure on the healthcare workers that are overwhelmed by the coronavirus pandemic. The duration of the support here will be determined as the situation evolves, but our team of highly qualified military medical professionals remain committed to assisting for as long as needed. Thank you so much for having us here. We are delighted to be here in support of the local teams, and we will do our very best to get through this together. Appreciate it.
Thank you. Thanks.
Hey, thank you. Hey, good afternoon. I'm Major General Sean Mankey, the Adjutant General of Minnesota National Guard, and am humbled and honored to be the leader of the over 13,000 citizen soldiers and airmen that we have in the Minnesota National Guard. Our state and nation have been extremely busy since March of 2020 with the COVID pandemic. And as Governor Walz has tasked us numerous times to assist in this, both at the state level and at the community level. You know, and our service members in the Minnesota National Guard, as opposed to Lieutenant Colonel Shealy's, we live here, we work here, and as evident in the last 18 months, we continue to serve here on a daily basis. So to the Minnesota National Guard soldiers and airmen, thank you for what you do professionally, and thank you for serving with dignity and respect. Unfortunately, the pandemic is once again placing significant strains on the healthcare community, as evidenced today. And yesterday, Governor Walz activated Minnesota National Guard to provide skilled nursing response teams to assist facilities experiencing severe healthcare staffing shortages. Together, the Minnesota Department of Health, other professional partners such as MNSCU and other technical universities, and the Minnesota National Guard medical staff will train